Hey guys, welcome to my video on I'm tired, and this should really be helpful for your step 3 preparation. See, I'm tired, or he or she is sluggish. So the family members are talking about the patient, saying that they're sluggish. The patient complains that they don't feel like doing anything, or the family members say, well, if he or she, their mom, dad is apathetic. And it's not a good approach to memorize certain things, like thinking, oh, well, a senior citizen, you know, he can't have a mood disorder, so I'm just going to put that he has Alzheimer's. And that's a completely wrong approach. And a young person doesn't necessarily have a mood disorder. So if it's a young person who's complaining of tiredness, it could be some kind of neurological or biochemical abnormality that's causing them to feel this way. So I just want to start off by if you see two different things, you can definitely focus on a diagnosis. And those definite things are delayed relaxation phase of reflexes. So if anywhere in your vignette there's a statement like that, you know that it's hypothyroidism. That's very specific to hypothyroidism. And hypothyroidism also explains a lot of mood symptoms, a lot of sluggishness. So even if there's a lot of lines about depression, depressive mood, sluggishness, if you see this statement, it's hypothyroidism. But one thing is, if you just see delayed reflexes, that's not specific to hypothyroidism, so just be careful. And another, so this is one. And so 2 is difficulty rising from a chair. So what that is, it tells you that there's some kind of proximal muscle disease. And usually when it says difficulty rising from a chair, it'll also say difficulty going upstairs. But in these patients who have these kinds of symptoms, usually they can do things with their fingers. Like they can do fine movements because those are the last to go. And the diseases that you want to think of are things like polymyositis, things like Graves'. And in another video, I'm going to go over how to narrow down the choices from those. But just think of looking for this specific statement, difficulty rising from the chair, and also, I'm going to write it here, difficulty going up the stairs. So after you've excluded the presence of these two statements, and you've also excluded any possibility of an illicit or prescription drug overdose, so look in the history for if they've ever been prescribed extra drugs that can cause addiction, that can cause toxicity, anticholinergics. So after you've excluded that, you're going to look for symptoms of nightmares and avoidance. And then you're going to look for a stressor. And I say this because it's a lot easier to eyeball the nightmares and avoidance, especially for me, in vignettes, than it is to just look for a stressor and then look for those. So if you see those, then usually you will see a stressor. And it's just a quicker process. That's how I think of it. You're going to then look at the time, and of course you can diagnose a PTSD versus an ASD, acute stress disorder. But if there's a death of a loved one and there's no other stressor, the only possibility is bereavement. Okay. So if there are no nightmares and avoidance, but you do have mood symptoms, so you see things like, you know, they don't feel like doing anything anymore, and they have trouble sleeping, their work function is being interfered with, you're going to then try and rule out major depressive disorder with that SIGI-CAPS acronym that's so popular. And if that is ruled out, then you'll look for adjustment disorder with depressed mood. Now, if all these things that I've mentioned from the beginning are absent, then you're going to look for clues suggesting anemia. So if somebody is tired, short of breath, and they have some kind of dietary deficiency, you'll see it in that the person just eats tea, toast and tea, crackers. They live alone. They don't have their relatives visiting them. And that would be a folate deficiency, but just look for those specific clues if you don't see any of these above things. Now, if it's a young person, because, I mean, generally younger people tend to go for bariatric surgery, especially under 60. Although, you know, at any age, there's people getting bariatric surgery done, because a bariatric surgery is going to cause a vitamin B deficiency and a vitamin D deficiency, and likely they'll have anemia and some kind of tiredness, and perhaps the vignette will have other clinical problems like gastrointestinal distress. So the other thing in a younger patient, and this kind of got covered up, is type 2 diabetes treatment. So if the person is on metformin, because that can cause vitamin B deficiency, B12 deficiency. And the last thing is, so if you have ruled all these things out that I just mentioned, then you look for the choices that would make sense for a structural brain, so neurocognitive abnormality like Alzheimer's, Lewy body, frontal temporal dementia, and Lewy body and frontal temporal have fairly obvious symptoms, so those are not very difficult. You could probably rule them off right off the bat. Alright, thank you so much for watching my video, and please subscribe to my channel.